Hi, welcome to this video on Medicare and Medicare supplements. My name is Chris. I'm your life health exam coach, and we have a lot of great content that you can check out and a guarantee to help you pass your life health exam. So please check us out if you haven't yet at lifehealthexamcoach.com, and you can get access to all of that content and make sure that you pass so that's the purpose today. We're going to focus on Medicare and Medicare supplements, which is an important topic. It does come up on the exam, and so you do need to know this information. First of all, if you're not familiar with Medicare, it is health insurance administered by CMS, which stands for the Centers for Medicare and Medicaid Services. They're the overall governing body. It's government insurance, and so it is run by that government organization. So it's federal government program, and it is funded by payroll taxes. All of us are paying into that as we work. You might have noticed that line item on any paycheck that you've had that says, Medicare. So that's where you're paying into these, taxes that you're paying in to receive Medicare once you turn 65. So that's the goal. It was designed for people who are, 65 and older, or if you're under 65, you can also qualify by virtue of having a disability. So one thing you need to know is this concept of original Medicare. This is how Medicare started. It's original. It's what the government originally offers. And original Medicare consists of two parts of your health insurance. It is Medicare Part A, and that refers to your hospital insurance, and then Medicare Part B, which refers to everything that happens outside of the hospital, all the other services that are outpatient. So Part A is hospital, inpatient. Part A is outpatient. Everything that happens outside of the hospital, like doctor's appointments and all the other things that happen outside the context of being in the hospital. In the middle there, you see a Medicare card. It's a red, white, and blue card that will have Part A and Part B effective dates. So that's what we call original Medicare. That is the basic aspect that people qualify for when they're turning 65. Now, original Medicare was never designed to be 100% coverage. The government never agreed to that. They couldn't afford it, especially not in today's costly environment. So it does not pay 100% of costs. That's okay. Most health insurance doesn't. Part A has what's called a deductible, meaning an amount that you have to pay before it will pay. So if you go into the hospital and you have Medicare Part A, you're going to pay $1,632 as the deductible. That's how much the beneficiary, the person who has Medicare, will pay. Part B has a deductible too. It's much smaller. It's only $240. So after that, with Part B, then the insurance will cover 80%, and the beneficiary has to pay that deductible and pay 20%. Now with the Part A, after a person's paid the deductible, actually on Medicare Part A, person does not pay anything more. So it is 100% covered after they pay their deductible on Part A. But on Part B, you have basically what most people are familiar with in health insurance, which is an 80-20 cost share, where the insurance is covering 80% and the beneficiary is responsible for 20%. So Medicare, those are called gaps. They're costs that are not covered by that Medicare insurance. Now, what happened when Medicare started, they realized that some seniors would be interested and willing to pay for additional coverage that will cover those gap costs. As when people retire, they often have fixed incomes, and being able to cover almost 100% of their health costs can be a really great privilege and something that people would like a policy to cover. So Medicare supplements were born at the same time as Medicare. They were also named Medigap plans because they're covering those gaps, those costs that the Medicare insurance itself is not covering. So these are private insurance plans that supplements original Medicare. So you can think of it as a secondary policy that's sitting on top of your primary insurance, which is your parts A and B. The Medicare supplement is sitting on top of that as a private policy, secondary policy that's covering those gaps in costs that Medicare does not cover. So basically, you're going to pay premium for a plan that covers most all of your gap costs. So when you have Medicare plus a Medicare supplement, it can cover close to 100% of medical costs, and that's why it's attractive. That's why it is, an option. If you choose to go that route, it is something that you can sell, and you can see why people would be interested in it. So again, just to sum this up with a chart view: original Medicare, Part A, hospitalization; Part B, your outpatient services. Now, for Part A, just so you know, most of the people who've worked in this country do not have to pay any premium at all for Part A. So that money you're putting into your payroll taxes for Medicare will cover the costs of having Part A when you turn 65. Part B, on the other hand, there is a premium, a monthly premium that is charged for the privilege of having Part B coverage. And right now, it's approximately $174 a month if a person wants Part B. Again, this is government insurance, so Part A you don't have to pay for usually. Part B you do have to pay for that. If you want more coverage beyond that sort of 80/20 cost sharing, you can add the private Medicare supplement on top of that. It's going to pay the claims after original Medicare. So it's going to cover, again, those gaps that Medicare does not cover. Now, you have to be enrolled in Part A and Part B in order to qualify or be able to get a Medicare supplement, which makes sense. Part A and Part B are going to be your primary insurance, and the supplement is going to be a secondary insurance. So it relies on the primary insurance paying first, then the supplement comes in behind that and pays those cost gaps. Just to complicate things a little bit further, just to be aware of this, you may see some questions on the exam about Medicare and the different parts of Medicare. So again, if you have Medicare Part A and Part B, we've explained you can have a Medicare supplement. Nowhere in here, though, is there any coverage for prescription drugs. Part A and Part B, for the most part, do not cover prescription drugs outside of, the hospital or outside of certain injectable drugs. Most of your prescriptions that you get that you have to pick up, like at a drugstore, are not covered by Part A, not covered by Part B, and therefore also not covered by the supplement. You have to have a separate, what's called standalone Part D prescription drug plan. Now, that's also part of Medicare. It's called Part D of Medicare, D for drugs. So when you have original Medicare plus a supplement, in order to have prescription coverage, you have to get a separate standalone Part D drug plan. So again, you have to have Medicare and B or B to get that prescription drug plan. So a person who chooses to get their Medicare this way is going to have their original Medicare card, they're going to have a Medicare supplement card, and they're going to have a separate card for their Part D because it's a separate plan, and they will pay a separate premium for that prescription drug plan. So it's kind of a lot, right? This is why sometimes people get confused, especially seniors, by Medicare insurance because it has these different components to it. When we're under 65 and on an employer plan, normally it's just one plan that takes care of, you know, costs and one thing you have to be concerned about. So Medicare is a little different in that way. It has these different components to it. And it's good for you to know that. There can be questions about that on the exam. Again, the Medicare supplement is a separate plan, and then the prescription drug Part D is another separate plan. So really, there's three insurances that are working for one individual in this case: the original Medicare, the supplement, and then the standalone prescription drug plan in this scenario. Now, in another video, I described Medicare Advantage plans. That's a different Medicare option that's completely separate than what we've just described as a Medicare supplement path. So we've talked about today option one, which is people who keep their original Medicare and add a supplement and then add a Part D plan. Option two is Medicare Advantage, and those are all in one plans, and you can learn about that in my other video. So check out the other videos on Medicare Advantage so you understand both of these options, because you will see some questions on the test that you need to know that distinction for. All right, just to recap, what do you need to remember for the exam? Part A and Part B are what we call original Medicare. It's government insurance, and it's offered, to people who are over 65, also to people who are disabled under 65. Medicare supplements, also known as Medigap plans, are private insurance plans that cover the gaps or the costs of original Medicare. So remember those things, you're going to do great. You're going to pass your exam and be an agent in no time. Remember, we have a lot of great content, lifehealthexamcoach.com. So go there and look for that content so you can make sure and pass. Hey, thanks for spending time to go over this video today. We'll see you in another video. Take care.